Welcome. In this explainer, we're going to add a really crucial set of tools to your clinical toolkit. We're moving beyond the prescription pad to give you a practical, functional overview of psychotherapy. And this is all designed specifically for you as a medical trainee. So let's just dive right in with a pretty fundamental question. You're building up your skills with medications, with diagnostics, but what about the evidence-based conversational tools, the ones that can literally change a patient's outcome? Well, that's exactly what we're going to dig into today. Here's a quick look at our roadmap. We'll start with a solid definition. Then we'll open up the toolbox of all the different therapies. After that, we'll get into how therapy is actually delivered, when you should think about making a referral, and then we'll bring it all home to your role in primary care. Okay, first things first. To use any tool effectively, you've got to know what it is, right? So let's establish a really clear working definition of psychotherapy. So what's the big takeaway here? The crucial point is that psychotherapy is not just a supportive chat. It's a structured, interpersonal treatment. It's grounded in real psychological principles, and it's always tailored specifically to that individual patient. All right, now for the fun part, let's open up that toolbox. We're going to explore the major types of therapy that you'll be working with and referring your patients to. Okay, think of this as your high-level cheat sheet. Each one of these is a different tool for a totally different job. You've got CBT, which is all about changing thinking patterns. Then there's psychodynamic therapy. That's kind of like an archaeological dig into someone's past to figure out the present. IPT zooms in on the here and now of relationships. And motivational interviewing, that's all about sparking that internal drive for change. So let's zoom in on CBT for a second, because it's one of the most widely used and heavily researched therapies you're going to encounter. It really is a workhorse in mental health treatment. CBT is super active. It's not a passive process at all. It's really a skills-based approach. So patients learn to spot their own unhelpful thought patterns. Things like, if I fail this one exam, my entire career is over. Then they learn to observe themselves in a new way, and then they actively practice new cognitive and behavioral skills. Basically, it empowers them to become their own therapist. Now, let's completely shift gears to a different approach. This quote, it really gets to the heart of psychodynamic therapy. See, while CBT is focused on the thoughts you're having right now, psychodynamic therapy looks back. It explores how our past, our childhood, old conflicts is actively shaping our present reality. And of course, the toolbox is huge. You've also got IPT, which is fantastic for patients who are struggling with grief or going through major life changes. Then there's DBT, a super specialized form of CBT for patients with severe emotional dysregulation. Think borderline personality disorder. And then you have supportive psychotherapy, which honestly is a tool you're probably already using to help your patients cope with illness and life crises. Okay, so we've got a map of the main therapies. Now let's talk about how they're actually delivered to patients out there in the real world. So yeah, one-on-one individual therapy is by far the most common format you'll see, but you really don't want to overlook the others. Group therapy can create these incredibly powerful support networks, and couple and family therapy can get right to the heart of the systemic and relational issues that might be going on. And here's a massive shift we've seen in recent years. Telehealth. This number, 50%, that's roughly the proportion of psychotherapy that can now be delivered remotely. This has been a huge deal, dramatically increasing access for patients who face all sorts of barriers to getting in-person care. So the big question is, does this shift to remote care mean we're compromising on quality? Well, the data says a clear no. For CBT at least, major studies have found that remote delivery is just as effective as in-person treatment. And that, right there, is a total game changer. It proves we can expand access without having to sacrifice quality. Okay, this brings us to a really critical decision point in your day-to-day practice. It's all about knowing the signs. When should you actively be thinking about referring a patient for psychotherapy? So this slide basically lays out your key green lights. A formal psychiatric diagnosis, that's an obvious one, but it's so much broader than that. You should consider a referral to help change unhelpful behaviors, to provide support during a crisis, to help boost motivation for things like smoking cessation, to address relationship distress, or even to improve a family's cooperation with a medical treatment plan. And finally, let's bring all this together and talk about the context where most mental health treatment in this country actually begins: primary care. Your setting is really unique, and your role is absolutely vital. It is so essential to understand this landscape. In primary care, you're going to see a lot more depression and anxiety, and treatment is often focused on medication and pretty brief interventions. Specialty care, on the other hand, usually handles more complex or psychotic disorders and involves longer courses of therapy. Knowing this difference helps you make the right referrals and manage everyone's expectations. And listen, this is so empowering. You don't always have to refer out. The research is clear that brief, focused interventions, we're talking even just a handful of CBT sessions, can be incredibly effective when they're delivered by trained clinicians right there in the primary care setting. So look, if there is one thing you take away from all this today, let it be this. Psychotherapy is not some separate alternative path. It is an evidence-based, powerful, and frankly, necessary addition to your clinical toolkit that directly expands your ability to help your patients function and feel better. So, as we wrap things up, I just want to leave you with this question to carry forward. Now that you're armed with this framework, how might you approach your very next patient conversation just a little bit differently? Thanks so much for tuning in.